Earlier, I spoke to Dr. Katherine Henderson. She's president of the Royal College of Emergency Medicine, and she's also an A&E consultant at a central London hospital.
London is very busy. There's no question that London is ahead of the rest of the country in terms of seeing cases and seeing sick people. So everything that we learn everywhere outside London needs to look at and think about and use the extra time to plan so that they're ready when they start seeing a surge of patients.
And what's the state of the service across the capital? We had yesterday Northwick Park Hospital in Harrow, the first to declare a critical incident because of a surge in patients. Will that be replicated?
Well, I think generally in London, we're doing an awful lot of planning and there are pretty good levels of facilities. I mean, some hospitals are perhaps starting from a more difficult position, but everybody is planning like fury and we're trying to get capacity built up.
And how do you do that, freeing up capacity? We've had the news today that the private sector is providing 8,000 hospital beds and 1,200 ventilators and 10,000 nurses, 700 doctors, but you need more than that, I imagine.
The emergency medicine area, we're expanding our footprint. So we are taking over clinic space next to our departments. We're dividing our departments up into respiratory areas and non-respiratory, because there's obviously going to be people still coming in with heart attacks or, acute appendicitis, and we've got to keep those patients safe as well. And we're sharing work. So we've got orthopedic teams which are taking on the sort of musculoskeletal patients that come in. There's a lot of routine work that's now being stepped down, which is therefore releasing capacity, along with all the extraordinary measures of going outside the organisation to find more capacity.
And when there isn't enough capacity, what will that do to the service that you can provide?
We're not at that stage yet, and I think it's probably pretty ineffective to think we're going to run out of capacity when we're just at this stage now. We're doing everything we can to make sure that we don't run out of capacity.
And what do you make of the position that health workers like you are put in terms of no or not enough testing of whether you've got COVID-19, and also questions about the protective gear you're given, the availability of it and the suitability of it?
So starting off with the testing, yes, obviously we're all very keen to start getting to the point where it's possible to test staff, and there's plans afoot to increase the amount of testing, and we need to see that that does come through to the front line. It's going to make a big difference to be able to test staff, because we have got quite a lot of staff who are having to self-isolate, sometimes for 14 days because of a family member contact. They may be fit and well themselves, and obviously if we can get those people back to work as soon as possible, that would be absolutely great. On the personal protection, that's been a really hot topic, and doctors and nurses have felt uncomfortable about the advice that they were previously giving. There's been a lot that's been sent out. I know that particularly London hospitals have had a lot of supplies that have arrived at the end of last week and this weekend. We need to see that we can get that to the right places. We need to make sure that we're wearing the kit that we feel is appropriate. And I suspect that that will change over time as we get hospitals more and more full with patients that actually have COVID-19.
Do you worry that as it stands, we're potentially heading to a situation like is being reported in Italy, where doctors in intensive care units there are having to make very grim decisions in terms of who they treat and who they don't treat?
The absolute determination is that we do not need to change the way we make decisions about patients going into intensive care units. We all are determined to make good decisions with patients' wishes borne in mind, so that we don't get into that situation.
Dr. Katherine Henderson.